As we know, early stages of hip AVN, basically stage 1 and stage 2 of hip AVN, can be managed medically without the need of surgery. So let's discuss how we do the medical management of a hip AVN patient. So the medical management has three important components. The number one component is increasing blood supply towards the hip joint. This is done with the help of medicines which increase blood flow towards the hip joint, which makes your blood thin so that it can easily flow through the small blood vessels which supply your hip joint. There are various types of medicines which come in this category like warfarin, heparin, enoxaparin, fondaparinux, and so many. And the choice of the correct blood thinner and the medicine to increase the blood flow depends upon the doctor who is deciding the treatment for you, upon your physiology, upon other medical conditions that you may be suffering from. The next step in the medical management of a hip AVN patient is giving sufficient nutrition to the diseased bone. This is done in the form of vitamins, vitamin A, vitamin D, vitamin C, vitamin E, vitamin B12, and calciums and other essential minerals which help in reconstituting the bone which has become soft, diseased, and can easily break due to the vascular necrosis. Apart from these two medical components, there's a third component of the medical management which is preventing excessive stress on the hip joint. Because in a hip AVN, the hip ball becomes soft and can easily fracture. To prevent this, we normally do two things. The one thing is strengthening of the muscles. There are a lot of muscles around the hip joint which maintain its strength, protects it from any unwanted forces, and also prevents any kind of fracture in the hip joint. Normally, they are called as flexors, abductors, and extensors of the hip joint. So, the exercise regime which focuses on strengthening all three groups of muscles is very important for a complete recovery from the medical point of view for a hip AVN patient. At the same time, to prevent any kind of stress injury to the soft bone of hip joint, we prevent the patient from indulging in stressful activities which can add excessive stress to the hip joint like running, jumping, jogging, dancing, etc. All these activities can cause a hip fracture which can convert an early stage hip AVN into an advanced stage hip AVN, resulting in the need for surgery. So summarizing again, there are three components for the medical management of hip AVN. Number one, medicines which increase blood supply towards the hip joint. Number two, the nutritional support to the diseased hip joint. And number three, activities to strengthen the muscles and prevent any kind of stress on the hip joint itself. By following all three components, majority of the patients in early disease of hip AVN can have wonderful recovery, can avoid surgery, can lead a normal life, and be pain-free forever.